So below the belt, one of my doctors said, Kim, there are always seminars for women. We need one for guys. And I went, all right. So I'm dedicating this one to Dr. Ken Felch because he's the one who got me started on this. I'm just going to say that this is intended for healthcare professionals only. It's not necessarily the opinions of Standard Process or MediHerb. I'm not trying to diagnose or treat any disease, but I will tell you I have done a ton of my own clinical research on this, and you're in very good hands today with this particular topic. So this is what I was about to say, that it's been said that men will come into your office for two different things. They either can't get it up or they can't get it out. So we're actually going to focus on both of these things because both of these are related to the prostate gland. Okay, so just a few basics on the prostate gland. As men age, the prostate grows bigger as the years pass by, and this begins around the age of 25. And the issues that are associated with the prostate are difficulty urinating, or a need for frequent urination, a lack of sleep due to this, due to waking up several times at night, due to needing to pee, but also because of the geography of where the prostate is located in the body. Low back, hip, or pelvic pain are also associated with prostate issues, as well as erectile dysfunction and male infertility. So we're going to start by looking at the medication that is #1 for prostate issues as far as what's prescribed by doctors, and that is known as alpha blockers, more commonly known as Flomax. And Flomax is used not only for most prostate issues, such as benign prostatic hypertrophy, but also erectile dysfunction. And the function of an alpha blocker, and this is very interesting, this helps us to start this conversation about nutritional support, is the fact that alpha blockers are vasodilators. They relax the muscles in the bladder and the prostate, which makes it easier to pee. So it makes it easier for guys to get it up, get it out. But Flomax or alpha blockers don't stop the prostate from growing. And what I learned, and I have a visual for you, is that the prostate usually starts the size of a walnut or ping pong ball, but it can grow to the size of a tennis ball or even larger. So you can see the difference between the two. Tennis ball is several times larger than a ping pong ball. Okay, and what it does is because the prostate is located below the bladder, it pushes up and it's going to put pressure on the bladder, and that's why it causes the symptoms that men have. And then, so Flomax does not stop the prostate from growing, so it continues to grow. And the side effects of alpha blockers are dizziness, drowsiness, headaches, sleep issues, which men already have with prostate issues, and abnormal ejaculation. It affects the eyes, and you mustn't take if you've got kidney or liver disease or prostate cancer. What's interesting about alpha blockers or Flomax is that it lowers blood pressure. And this is what got me thinking about a novel approach or a new approach to prostate health, is because it acts similarly to nitric oxide. Well, what is nitric oxide? Nitric oxide is made by our blood vessels lining, or our endothelium. And the endothelium is sensitive to conditions inside of our blood vessels and will make or decrease nitric oxide accordingly. So basically what happens is the healthier we are, the more nitric oxide our blood vessel lining produces, and the unhealthier we are, the less. So it actually creates a downward spiral. And one of the conditions, there's a few different conditions such as type 2 diabetes, high cholesterol would be one that decreases nitric oxide levels as well. And I'll talk about the others as well. Here, I wanted to put this clinical study in here. This was back in 2008, but they were starting to look at the nitric oxide pathway regarding the human prostate and clinical implications in men with lower urinary tract symptoms, because not only is the prostate going to be involved, but the kidney and the bladder. Obviously the bladder, because the bladder is being directly affected by a swollen prostate. And they did find that there is definitely a connection between nitric oxide and the prostate gland. Turns out that penile erection. So here we talk about can't get it up, can't get it out. So erectile dysfunction or penile erection depends on the release of nitric oxide. Again, remember, it's blood vessel health, the lining of our blood vessels. And that Viagra and other drugs that reduce erectile dysfunction are working on the nitric oxide pathway. Okay, so I mentioned already type 2 diabetes, poor blood vessel health, of course, because the lining of our blood vessels is what makes nitric oxide. Smoking, but this is where we're going to emphasize because this is critical. So does microbial burden. So this is another aspect of stealth pathogens or microbial burden. And I go into helping to understand what these are in detail on my webinar, which is on my website. So it's called Stealth Pathogens or Microbial Burden. And my website is kimsperryconsulting.com. I'd highly encourage you to take a look at that when you can. Okay, so we're going to take a three-pronged approach to improve prostate fitness. One, very, very important, we're going to address microbial burden, and we're going to therefore increase nitric oxide levels, because remember, microbial burden will decrease nitric oxide levels. Very important to remember. Two, we're going to increase urination. You want to help the guys get it out. And three, remember, alpha blockers or Flomax don't do this. We are going to choose herbs that reduce the swelling of the prostate, which will take pressure off of the bladder and urinary tract, and all without any side effects. Okay, so again, herbal therapy must possess antimicrobial properties, but also be able to stop the collateral damage. And again, going back to that previous webinar, I talk about the different steps that microbes take to protect themselves, hidden to hide and protect. One is biofilm, and the other is that they'll destroy our nitric oxide. And I just wanted to put a piece in here. I'll let you know, most of my clinical references are noted at the very end of my presentation. I've got 3 pages. And then what I did in my earlier, my later research is I continue to add the clinical studies to this. So you'll see them scattered throughout and at the end. Bacterial strains able to produce biofilms are consistently present in chronic bacterial prostatitis and prostatic calcifications. Bacteria is a microorganism, and we're going to break down the microbial burden or the microorganisms so you see all of them. So you see 5 of them listed here, and we're going to address all of these. So bacteria, so these are the ones that specifically affect the prostate gland. Bacteria, especially E. coli, parasites, especially Toxoplasma gondii, viruses, HPV, herpes, especially genital herpes, cytomegalovirus, all sexually transmitted diseases. What's interesting is now they're looking at sexually transmitted diseases with prostate cancer. So they do seem to eventually lead to prostate cancer. Fungus, especially Candida, will affect the prostate. And again, this is critical, GMO agricultural exposure. Because of the pesticides, pesticides are genetically modified bacteria in the soil. And you'll see some very interesting studies regarding this. So I'm going to take these one at a time. So here, we're going to start with bacteria as part of the microbial burden. Around 87% of the cases of acute bacterial prostatitis are due to E. coli. That's huge. Acute prostatitis is usually caused by the same bacteria, E. coli, that cause urinary tract infections or sexually transmitted diseases. I thought that was interesting too. Parasites. Okay, now we're going to the next arm of this microbial burden. Parasites. Toxoplasma gondii, we said, was the one parasite that affects the prostate gland more than any of the other parasites. Well, it turns out that Toxoplasma gondii is considered the most successful parasite on the planet. It infects over half of the world's population, including about 50 million Americans. It can get into the brain, and this is the strange thing about Toxoplasma, and it invades the body and hijacks our immune cells and forces our immune cells to commit suicide. So very dangerous to our immune system. And as far as how it affects the prostate specifically, it induces prostatic inflammation and hyperplasia. Therefore, the beginning of the growth of the prostate from the ping pong ball or the walnut to the tennis ball. Toxoplasma gondii spreads to the prostate within 2 weeks of infection and remains in the form of latent tissue cysts, which contribute to benign prostatic hypertrophy and cancer. And it can persist for the rest of one's life. Okay, so we've talked about bacteria, talked about parasites. Now here's another arm to the microbial burden, and that's viruses. HPV and herpes viruses have long been hypothesized to contribute to prostate cancer risk. Cytomegalovirus has been detected in pre-malignant and malignant prostate tissue and has been shown to elicit prostate inflammation. Again, you get that inflammation started, it's going to increase the size of the prostate. And again, men infected with genital herpes as young adults are at a 2-fold increased risk of developing prostate cancer by middle age. And this was a study conducted in the US military. This I found too, that I thought was really interesting, is they did find, again, sexually transmitted diseases, which is the HSV2, also known as genital herpes, definitely are connected. I think it was a 97% connection to prostate cancer. It's a really interesting article, and I do have the reference for that. But it was very interesting that they just had to give it long enough in order to see that connection, because there's a long latency period for prostate cancer development. Okay, so we've discussed a lot of the arms of the microbial burden. Here's another one, fungus. Fungus, especially remember Candida is the main one, but fungus causes changes in the prostate that mimic bacterial infection, benign prostatic hypertrophy, or neoplasm. And neoplasm is the growth of abnormal tissue, hopefully benign, but it could also be the beginning of cancer. And I wanted to put this clinical study in here too, that I thought was excellent, because here was a 20-year undiagnosed, they could not figure out what was causing this chronic prostatitis. They tried everything until they realized that it was a case of a candida infection that caused the prostatitis. And my screen just, there we go. Okay, let me just go back. Okay. Okay, this is the last piece, and not necessarily the most dangerous, but incredibly dangerous and very important to address, is the fact of GMO agricultural exposure. This is genetically modified organism, is what GMO stands for. And again, this means that bacteria, soil-based microorganisms have been modified to create pesticides, and now they're finding pesticide exposure in general is linked to several types of cancer, including prostate cancer. And pesticides are known as endocrine disruptors. They disturb the sex steroid hormone system. So yes, there are plenty of comments on DHT, which we'll talk about slightly at the end, prolactin imbalance, but it's quite possible that all of these sex steroid hormone imbalances are actually coming from a microbial burden and more than likely pesticides. And here I thought this was fascinating. Toxic fairways study conducted by the Attorney General of New York. 52 responding golf courses reported using over 200,000 pounds of dry pesticides and close to 9,000 gallons of liquid pesticides on their courses annually, translating into 7 pounds of pesticides used per acre per year. You never see weeds on the golf course. And remember that the prostate functions as a filter to protect the sperm from contamination. So the prostate gland is going to be extremely susceptible to toxic influences, including pesticides. So again, we need to address the microbial burden. We want to increase urination, and we want to reduce the swelling of the prostate. So how do we do that? I'm going to start with a product that in the field I hear rave results with. Why not start with the very best? And this is a medi-herb product, and it's called Prostaco. So Prostaco contains nearly 3,000 milligrams or 3 grams per soft gel capsule of nettle root, saw palmetto, cratiava nervala, and pumpkin seed oil. And what this product is going to do is address all 3 prongs that we talked about. Addressing microbial burden, increases urination, and will reduce the swollen inner lining. So how does it do that? So first of all, I want to say it really helps if you understand how to read a medi-herb label correctly, because it's not easy to see. And what you need to look at is not the right-hand side, and I'm hoping that you can see my cursor. You want to look at the left-hand side, because this is the beginning amount of all of the herbs that have been turned into a concentrated liquid extract, and then either turned into a soft gel capsule or a tablet. So here's some basics to help distinguish between medi-herb and other products on the market. An average gelatin capsule, not talking about soft gel like we are here. We're talking about pull-apart gelatin capsules that you can buy at a health food store, can hold no more than 500 milligrams or 1/2 of a gram of dried powdered herb. I'll have to change that. So 1 gram or G is 1,000 milligrams. And Prostaco, if you take the 666, 1.07 grams, which is 1070 milligrams, plus 900 milligrams, plus 80 milligrams will give you 2,716 milligrams per soft gel. So it's going to be much higher in potency per capsule than most other products, and a better value for the money due to the cold extraction herbal tonic that's been turned into either a tablet or a soft gel. Okay, let's talk about the three-pronged effects. So we're going to go through each one of those 4 herbs that are in the product. First of all, remember we said fungus, especially Candida. Nettle root is antifungal. It's also antibacterial. In addition, it's used for breaking down kidney stones, bladder gravel, and uric acid from joints. Okay, so when you've got a prostate issue, it's quite often that you're going to have a bladder issue because of the pressure on the bladder, but you may have urinary tract infections as well. So this is going to help with that. But this I thought was interesting. This is anti-lithic in nature. This prevents calculus formation, and calculus is made from petrified biofilm. Okay, so this means it's going to break down biofilm, which is one of the stealth pathogen or the microbe strategies. And using nettle root tea or fermented stinging nettle tea is an excellent fertilizer for our soils, can be used in gardens and plants. And it turns out that it's a really good parasite pest control, such as aphids found on plants. Okay, so it's not only antimicrobial, but you want to increase the flow. You want to get it out. Nettle increases the secretion and flow of urine, invaluable in cases of fluid retention and bladder infections. Now I'm showing the nettle root in liquid because it's also available in liquid, but they're taking that same liquid and turning it into the concentrate, which is part of the gelatin capsule. Just so you know, I didn't want there to be any confusion. Okay, and here's University of Maryland Medical Center, who says that symptoms of BPH, including reduced urinary flow, incomplete emptying of the bladder, and constant urge to urinate, may be relieved by nettle root. Similar to saw palmetto pygeum, which is from tomatoes, and beta cytosterol, which is used for cholesterol, and beta cytosterol is also found in saw palmetto, which we'll talk about. Nettle appears to reduce obstruction to urinary flow and decrease the need for nighttime urination. That is so important. It's a gradual acting nutritive herb that gently cleanses the body of metabolic waste, has a gentle stimulating effect on the lymphatic system, very important too, enhances the excretion of waste through the kidneys. So it's going to be very beneficial for kidney, bladder, urinary tract, prostate. German Commission and European Scientific Cooperative on Phytotherapy recommend nettle root use specifically to ease urinary problems associated with an enlarged prostate. Stinging nettle can also lower blood pressure. Okay, so remember the nitric oxide and how nitric oxide also lowers blood pressure. And stinging nettle triggers the release of nitric oxide, which causes the blood vessels to widen. That is a very valuable piece of information. In clinical studies, they found a dosage of at least 450 milligrams of dry stinging nettle roots is associated with the beneficial effects for benign prostatic hyperplasia. And you are getting more than that in each capsule of the Prostaco. Okay. Let's talk about saw palmetto, the other herb. This is again in the Prostaco. Saw palmetto is going to help with the microbial burden as well. It's antibacterial and antifungal. It inhibits biofilm formation by staph. So again, very important to stop the stealth or the hidden strategy of these microbes that are getting inside of our body. And one of the important pieces is inhibiting biofilm, which saw palmetto will do. So it not only inhibits biofilm, but also E. coli and Candida. Remember, these two are specifically targeting the prostate. It's a source of lauric acid, which is a product that you can buy by itself for candida. And it turns out that it's already in saw palmetto. And it's a source of beta sitosterol, which we talked about a little bit earlier, which helps reduce cholesterol levels. And again, the high cholesterol levels are again linked to low nitric oxide. So just very interesting to see the connection between all of these. Saw palmetto here again, remember this is something that the alpha blockers cannot do. It shrinks the inner lining of the prostate, which helps reduce the pressure on the bladder and create the urge to urinate. Excuse me. Here is a clinical study showing that it enhances erectile responses. So it's going to help with ED as well as BPH by inhibiting PDT5 activity and increases nitric oxide and messenger RNA. The conclusion of this study is that saw palmetto extract has potential application value for the prevention or treatment of erectile dysfunction through the increase of nitric oxide and messenger RNA expression. And then PDE5, because it inhibits it, PDE5, when you inhibit it, it relaxes the blood vessels and increases blood, and that's what helps increase nitric oxide. More on saw palmetto. It reportedly blocks response of prostate cells to prolactin. And we mentioned that we talk a little bit about DHT and prolactin, and saw palmetto will help this. Let's see. Saw palmetto also inhibits 5-HETE to stimulate the growth of prostate cancer cells. So it inhibits that, which is really important. Source of beta sitosterol, which we've already talked about. Cratiava nervala. Okay, this I thought was really interesting. So we're still talking about the prostate, but I want you to know that there's got some very interesting uses for women. This entire product does. Cratiava nervala strong suit is antibacterial. Okay, so it's going to help with the microbial burden, especially E. coli. Again, E. coli is the one that affects the prostate. E. coli infections in the urinary tract. So not only the prostate, but the urinary tract, especially useful in cases of antibiotic resistance. And boy, do we have antibiotic resistance these days. In fact, antibiotic resistance is considered one of the top 10 threats to global health these days. This was interesting. So this is concentrated extracts of Cratiava nervala. They found that it is excellent for an overactive bladder and urinary incontinence, excuse me. And men as well as women participated in this study. And here we go. So here's the conclusion. Out of 150 participants, they found with just 8 weeks of treatment, an excellent result as far as reduction of urinary incontinence. So this is something that this product can actually be used for urinary incontinence as well. So lupiol, which is an active ingredient, which is in the Cratiava nervala, is anti-inflammatory, which is going to help shrink the prostate. Antimicrobial, anti-protozoal, found in highest concentrations in the stem bark, which is what the medi-herb is from. Antifungal, I thought this was interesting. Potent antifungal compound against opportunistic human and phytopathogenic mold. That's mold that is attacking our vegetation. This particular mold is considered one of the most destructive necrotic fungal pathogens that affects more than 500 plant species throughout the world. And the lupiol, which is found in the Cratiava nervala, is going to be very good to help with that. Okay, so Prostaco, and this is what I loved, is I thought I wanted to find out about the safety of anything that I'm recommending. And it turns out that all of the ingredients that are in Prostaco are considered safe, completely safe, can be used with medications, and it can be used by women, which I thought was cool. Here we go. The Cratiava nervala also imparts protection against androgen-induced oxidative injury in the prostate. After treatment, patients had a marked relief in symptoms such as incontinence, urination frequency, pain, and urine retention. And then the last ingredient in the Prostaco is pumpkin seeds. And so here are some of the protective properties of pumpkin seeds, including cytoprotective. So it's going to help improve the cell health, which is important. Very good for prostate disorders. Here's one study that shows a pumpkin seed extract used for 3 months in 53 men ages 50 to 80 years old, increased urinary flow volume, so very important to help get it out, by 40% and decreased nighttime urinary frequency by 30% compared to those on the placebo. They seem to be remarkably effective in treating overactive bladder, which contributes to urinary incontinence. High in zinc, because the prostate gland is very high in zinc naturally. And here's a 2011 study showing malignant prostate tissue and prostate tissue from men with BPH had significantly less zinc than normal prostate tissue. And again, pumpkin seeds will naturally increase zinc, which is great. And it regulates prolactin levels, which is also affects the prostate. Prostaco would be my first recommendation. To start there, the recommended amount is 3 daily. So I believe a jar will give you a 40-day supply. I believe it's 120 capsules. Prostaco is on back order. It's a very popular product, very successful product. Because it's on back order, my recommendation is if you want to try this is to go ahead and order it now so that when it does come back in stock, it's available. And due to the international crisis that we have been undergoing for the last 1.5 years, it has affected international shipping. And that is the biggest problem as to another reason why we don't have it. What you can use as a substitute, and artemisinin should hopefully be in soon as well. This is one of my all-time favorite products, but this artemisinin and myrrh together will also provide antimicrobial support, which is going to be important, just like we were talking about. But again, you can start with Prostaco. That's my first recommendation. If you find that Prostaco is not quite enough by itself, then I would recommend adding the artemisinin or the myrrh forte. And I will go into detail on that webinar on microbial burden. Inhibits the reproductive cycle of Toxoplasma gondii. Again, that's the one microbe that affects the prostate gland more than anything. And I'm going to scroll down to standard process Prosthetics because I want to share some information about Prosthetics and how this can be used as well. And excuse me. So it's used for an enlarged prostate, encourages urination, stimulates zinc absorption, and manages glucose. And what I did was I put some customer reviews because I always like looking to see how customer reviews are. And here's one that says, my prostate is enlarged and I was waking to use the restroom several times a night, which unfortunately happens to men with prostate issues. Prosthetics has cut the trips to 1 per night. Better sleep, happier days. Here's another one. For 5 years, my husband had been using this product as well as Palmettoplex and Prostate PMG. Palmettoplex is another good product for the prostate. This is another product that is out of stock. I don't believe it's available for ordering, but I will tell you when I compared Palmettoplex to Prostaco, Prostaco again is still a better value. So I'm going to still recommend going with Prostaco. Again, so Prosthetics was used to lower his PSA. After the first recheck of his test, his score had dropped considerably. And after the second recheck, it was within normal range, where it has stayed for the last 4.5 years. My husband is 59 and I will continue to use this product as it continues to keep his prostate healthy. I will keep buying it for him because he's worth it. Okay, so what I wanted to do is to give you a new perspective on how our prostate tissue works, and it's studies that are done with peptides. And so I'm going to explain Prosthetics from a peptide point of view. So prostate tissue extract helps reduce edema and prostatic inflammation and normalize the parameters of the prostate gland and semen, as well as the erectile function. Okay, very important. The other thing that I like to do is I love to combine the wisdom of both the plant or the herbal kingdom along with the animal kingdom. So you're going to be getting with the Prostaco and the Prosthetics, you're going to be getting both of those kingdoms. And you are getting the peptides of prostate tissue in the prostate. And it mentions it restores the protein secretion in a cell, therefore restoring their performance. These peptides epigenetically regulate gene expression, protein synthesis, and functions of the organs. Administration of peptide preparations have also been shown to normalize main functions of the human organism, such as decrease the aging pace and mortality. Peptides regulate gene activity by binding to a specific DNA region for storing and transmitting genetic information. Due to this binding, they regulate the conformation of DNA and gene expression and contribute to the stimulation of protein synthesis. This means a cell begins to work as in a young and healthy body. And here's a long study. This went from 1973 to 2014, where a Professor Cavinson extracted over 20 complexes of active peptides from various organs, all covered by patents in many countries, including the United States, Canada, Australia, Europe, Japan, Korea, Israel, etc. So this is all new information that's coming up regarding peptides that are found in the animal tissues. And that's why I'm recommending the Prosthetics. And I think that's it. And I just wanted to show you, I've got 3 pages of these additional references that will be available for you. That's all the information that I've got on the prostate for you today.
Amazing, Kim. Thank you. We have a couple of questions.
Okay.
They're actually related, so I'm going to read them all at once. Okay. Everyone, feel free to unmute if you need to make some things more specific. Kelly asks, if a patient is taking Cialis, are there any contraindications to taking any of these medications? And James also says, if taking Flomax, is there a reason not to take Prostaco at the same time?
Oh, interesting. So it turns out that in all of the research I did, Prostaco does not interact with any medications. It's considered very safe to take. And what I did was I went through each herb of the 4 herbs in that product and there was nothing. So I don't see any issues with taking it with Flomax or taking it with Cialis. Did you say that was the other one?
Yes.
Yeah. So there should be no issues with that. There are no herb drug interactions with Prostaco that I can find.
Although I would imagine that at some point you'd have to talk to your patient about the need for Flomax or Cialis now that you've taken these supplements, right?
Right, exactly. Because remember, there are side effects to using both medications. Exactly. So yeah, if you can do it naturally, it's not only going to stop any of the negative side effects, but it's going to benefit other parts of the body as well.
Yeah, and that's a rare time when you can use a drug and an herbal product at the same time. Sometimes when you do that, where they have the same effect on the body, supposedly, you can overdo things, right? That's usually a contraindication. So I really appreciate that you guys asked that question. Okay, also, Joe has a question. She has a 91-year-old patient who has a signaling problem. By the time he feels the need to urinate, he has already started in his pants. I've been adjusting him, but that doesn't seem to make any difference. Suggestions?
I would ask him about his microbial burden. So it may be a sensitive topic, but I would ask about their history of infections, including sexually transmitted diseases, because I'll bet, and is he a golfer or was he working on a golf course? Was he exposed to pesticides? That's going to be important too. I'd start there. And Prostaco, again, would be my recommendation, 3 a day. Start there.
Yeah, nice.
Oh, you know what I wanted to share too? One male doctor said, you know, men are like the secret club. It's really hard to get them into your office. And again, we learned today that they're either coming into your office because they can't get it up or they can't get it out. But they have, if they get results, they're going to tell all of their other male friends. Okay, Prostaco is a great product.
I can tell you that is true from experience. They will tell their friends. And also, Joe, you know, if this fellow is telling you this, I think you already have a really great relationship with him. He's probably going to be willing to give you more details. All right, Pamela has a question. Can you please review the use of Prostaco for women?
I didn't go into a lot of detail on that because this is to be a guy's seminar. But I found that, again, Pam, I don't have the research. I'll tell you, I use Nettle. I love it. Nettle is used not only for urinary tract infections, but I use Nettle on my face. Nettle leaf is a very high source of silica. As far as saw palmetto for women, I don't remember offhand, Pam. I'd have to do another webinar just on that offhand, but you can email me later and I can find that for you if you'd like.
And earlier you had said the Crotava,
Nervala, yes,
yeah,
for urinary incontinence for sure. That would be used for men and women.
I also asked you if women could use it for cystitis, correct?
Oh, yes. In that same study, it can be used for cystitis. Thank you, Jerome.
So there you go. Plus pumpkin seeds, that's good for everybody.
Probably urinary tract infections as well.
Nice. All right, Joe has another question that's a little bit off topic.
Okay.
So perhaps we can just talk about this real quick. What is the reason that we changed Livco from a tablet to a capsule?
Oh, no, that's fine. Because doctors were requesting a tablet without maltodextrin. So the new capsule will be the same concentrated extract, put it into a capsule. and there is no maltodextrin in there. It's also a vegetarian capsule.
Yeah, nice. Anybody else have any questions about the webinar or any other question for Kim now that you have her? I thought it was the nettle thing is interesting because of nettle's use also for allergies, right? That whole thing with, you know, allergies being inflammation or the puffing up of things.
Yes.
Right?
Yes.
If your nasal passages can get inflamed and or, you know, puffy, why can't that happen to the prostate? And why can't that be somewhat of the same mechanism? And why couldn't nettles help both things?
Mm-hmm. Mm-hmm. And this is, I realize this is a bit off topic because it's talking about nettle leaf rather than nettle root.
Sure.
But one thing that I learned about nettle leaf, and that's what I use topically on my skin, is that there's silica that's naturally in the soil that's really hard to digest. In fact, during the Dust Bowl, children died from inhaling the silica in the dust storm, which I thought was crazy.
Wow.
But what happens with the nettle plant is that silica, it pulls the silica from the soil and it ends up putting a bioavailable drop of silica on the leaves. So actually using the nettle leaves is an outstanding source of silica. So it's going to be not only really good for your skin if you're using it topically, but it's also going to be great to take it internally for your bones.
Wow. We have another question.
Okay.
Ariane, to review, what is in Prosthetics?
Okay, let's see. That's a good question too.
I can tell you what's in it, but maybe Kim can say more about that.
Let's see.
Want me
I'm
to
just
write
pulling.
it up? Yeah, it's Spanish moss.
Thank you, Sharon.
Yeah, it's a blend with Spanish moss, calcium, and bovine prostate cytosol extract.
And Ariane, what you can do is you can go to standardprocess.com. Once you've signed in, you just type in the search box any product name, and you'll see not only the nutrition label that Sharon just read off, but any associated literature with that particular product.